Hey, I'm Dr. Jones. I'm a pediatrician specializing in Black health and wellness, and today we are talking about seasonal allergies. It's springtime. I know everybody's suffering, but I'm here to give you some tips on how to reduce the symptoms and their severity. So first, you might notice that as soon as your child goes out to play on those first few days of spring when the weather is nice, they start sneezing a lot more. They might even start coughing a lot more at night. And they might wake up in the mornings with those swollen, red, puffy eyes that seem to water all the time. These are very common symptoms associated with seasonal allergies, but they're easily treatable. So what I usually recommend for my patients is that they control their allergies by, one, taking an antihistamine or an allergy medicine. So Claritin is popular. Zyrtec works the best in my opinion. Allegra is another option for kids. Zyrtec is the one that I'm most familiar with, and you can go up to 10 milligrams per day of the Zyrtec, and giving it at night is the best way to control the symptoms so that the medicine's already working in their system when they wake up and they go out to start their day. The other ways that you can control their allergy symptoms is making sure that they are taking a bath at night, washing their hair. If they're a boy with short hair, they can wash their hair at night, as well as their face. So you're washing all of that pollen off of their eyebrows, their eyelashes, and off of their hair. For a girl, making sure that you're washing their face, but putting on a hair cover, a bonnet or something like that, to make sure that when they go down to sleep, that they're not rolling around in that pollen on their pillow. The other way to reduce the amount of pollen that they're exposed to is to change their pillowcase at least every week, if you can't do it every day or every other day. Again, these are all ways to reduce the amount of pollen that they're exposed to. Your child with seasonal allergies might also have asthma. These are commonly seen together. And so your child with asthma might have more difficulty breathing when they're outside in the early spring months. They might even have that cough that is worse at night, as probably because of the pollen that's in their chest, and also because of the pollen that irritates their nasal cavity and causes that mucus to run down the back of their throat. Some common medications that are used for asthmatic kids with seasonal allergies: Singulair, which is also known as Montelukast gas, that helps reduce their lungs' reaction to the pollen. They also might take their albuterol before going outside. So giving the albuterol about 30 minutes before they go outside is going to help them breathe easier and not react as much to the pollen that's in the air. And then, of course, giving them Zyrtec at night to help them fight off those allergy symptoms as well.